Cristina Rivas, también de aquí de la Universidad Pompeu Fabra, y quería preguntar si han hecho algún estudio sobre el tipo de público que consume esta información, es decir, si son más profesionales, público en general, asociaciones de pacientes, etc.
There is a real gap in the literature. So we know much more about what we think are the flaws, the problems in the messages, but there has not been, in my mind, good research about how this is received. There is some interesting work being done by the foundation that supports my work. This is a foundation based in Boston called the Foundation for Informed Medical Decision Making. And they were the people who were behind that study that I cited about the poor quality of decision making between men and their physicians on prostate cancer screening. Now that's not answering what you asked me about responses to news, but I think that it all plays into the same picture, that men are misinformed, and for whatever role we as journalists play in the overall picture, we often are making things worse, not better. But the direct answer to your question is there's a big gap in the literature and a huge need for research in that area.
And who is the consumer of your web, of this?
Well, before we launched this, since it was new, we commissioned a panel of independent reviewers to give us advice. And they actually criticized us in saying, it does not appear that you have one single target audience. And I said, no, I accept that criticism because we don't. I think that journalists are our primary target, but remember, I expected journalists to be defensive and wouldn't listen, however they have. But if they didn't listen, then I wanted consumers and patients to learn from how we evaluate stories. And finally, I thought that physicians would appreciate what we're doing, because maybe in this time-consuming encounter with their patients, if a patient came in, waving a newspaper article or a printout from the internet on something they just heard about, which makes your job more difficult, that perhaps the physician could say, why don't you go to healthnewsreview.org and see how they evaluate evidence, and maybe you could learn from that. And indeed, even that third target audience has become reality. I think many physicians, many in healthcare, appreciate and applaud what we're doing, which has been very gratifying.
Hay dos preguntas.
¿Qué más podemos hacer para que el público exija que las noticias tengan esa calidad que deseamos?
I did briefly, I briefly touched on this, and when I have to make a point very quickly, I say it as simply as this, that if we could simply help consumers understand that in healthcare, more is not always better, newer is not always better, screening tests don't always make sense. At least from an American perspective, I can tell you, if we taught people those three things, we would have much higher quality health care, I believe at much lower costs.
Who must do this? Health education?
Well, I always look in the mirror first. So and my students get very frustrated with this. They'll say, Professor Schwitzer, why is this journalist's responsibility? And I said, well, I'm trained as a journalist. I'm not trained as a physician. If I were trained in medicine, I would be making trouble on that side of the street. But I do believe that there is an agenda-setting responsibility of journalists that has been abdicated in many regards, and perhaps nowhere more so than on these vital topics, which, as I've said, pertain to your health, your personal finances, our collective public health, our collective public finances. But as I back up from simply being a journalist, many people should have responsibility. It can be done in small incremental ways in your dealings with your physician. I think that the government, we spend a lot of tax money on government-supported health agencies in the U.S., and they could do a better job in helping to educate consumers. I wish that we did not allow direct-to-consumer drug advertising, because I think that it is going in the other...
This is not the case in Spain. So.
I know it is not, and you're fortunate, because I think that that's making public education so much more difficult, because it feeds this mentality that newer is better, more is better, that there is a pill for every ill, that you are all sick, and you all should be taking something.
Last question, please.
Joan Janem, family doctor in Barcelona. I find that one point is missing in your 10-point checkup. In this list, I would like to see the point of view of the patient, because this list displays very well a balanced approach of the evidence, but in health there is always the point of view of the patient, and maybe it's not well represented in this checkup.
The point is well taken, and it is difficult to, behind each one of these lines are several paragraphs of explanation on our website of how we apply these criteria. And indeed, since my sponsor is this foundation that I mentioned, the Foundation for Informed Medical Decision Making, they push me all the time to make sure that these criteria are as meaningful and as consumer-friendly as possible. In fact, can you go to the website for a minute? One of my frustrations has been that right now on the homepage, you don't even see these criteria. And I think that that was a mistake. And so we are undergoing a redesign, a new look for the website right now that I'm working on. Soon it will be on the internet, where the criteria will be much more prominent. Each of the 10 criteria will be listed with a hyperlink that will take you to 10 different pages, one for each of the criteria. And we will break down each one in more detail, giving you 3 story examples that were thumbs up, that did a good job, and why. 3 story examples that were bad, and why. A brief explanation about why this matters to you, the patient. And then, and I really like this, I'm going to be collecting patient and physician video interviews to put on the website to explain why each of those criteria matters in that patient's life from the patient perspective, and then why it matters in the patient's life from the physician's perspective. I think you'd be very happy with that, and I hope you come back to the site in about a month or so. I now see that that's what we should have done all along. I think it'll be a major improvement. So I hope that answers your question.
Thank you, Mr. Schwitzer.